introduction, Dr. Indriyati. Yes, I'm very delighted to participate in this quantitative studies workshop seminar series. So let me project my PowerPoint. So may I know if the slide is projecting from that side?
Yes, the slide is clear enough, I guess.
Very much.
How about the students all there? Clear enough?
Yes, it's clear. Yes, thank you very much. So today I would like to start my discussion about the cross-sectional study. The previous lecture was related to the cohort study, and the next lecture will be discussing about the descriptive statistics. So it is the 3-lecture series for this collaborative section. So cross-sectional study, actually cross-sectional study is very commonly used study design in the research field. So these are the learning objectives for our today's discussion. So first, we will discuss about the basic concept and then design about the cross-sectional study. After that, we will go a little bit further about the analysis of cross-sectional study data. So after this section, I would like to continue the discussion about the practical aspect of conducting the cross-sectional study. And we will end up our discussion with the strengths and limitation of cross-sectional studies. So these are the content and learning outcomes for today's section. So before going to the specific topic about the cross-sectional study, I would like to start with the overview of the epidemiological study designs. So all the epidemiological study designs, we can differentiate into 2 different parts. So first, if we have any intervention, any experiment, then we will go to the experimental intervention studies, such as the quasi-experimental study or RCTs. But if we do not include any intervention from the researcher, then we will go to the observational study. So observational studies are sometimes known as the non-interventional and non-interventional studies. So these observational studies can be subdivided into 2 different types. So the first group is known as the descriptive study. The second group is the analytical study. So I'm pretty sure that some of you have read before about the case report, case series. So this is about the quoting the single case or multiple cases, right? Initial presentation, initial cases. So they are considered under the descriptive studies. Another one is cross-sectional study. So today we are going to discuss the cross-sectional study. So this cross-sectional study can be used as a descriptive studies to investigate the magnitude of the problem, prevalence of the problem in a defined population. So sample survey or cross-sectional study can design as the descriptive studies. And on the other hand, analytical study. So for the analytical study, there is no intervention, but we usually compare 2 groups. For example, the previous lecture was related to the cohort study. So in the cohort study, we compare the exposure group and non-exposure group, and we follow up till the outcome. Right? So there is a comparison group in the analytical study design. So similar to that, case control study. So we have the comparison 2 groups, case group and control group. And then we look backward, what might be the associated factors. And the third one is the cross-sectional study. So for the cross-sectional study as well, we can design as an analytical study. So that's why cross-sectional study is a unique feature. It can be designed as the descriptive studies without comparison, just to investigate the prevalence, or otherwise it can be designed as the analytical study. So we will divide into 2 comparison groups and we will compare. So we'll discuss the details later. So this is the overview. Okay. So first of all, what is the cross-sectional study? So everyone is very familiar with the cross-sectional study, right? Maybe you have conducted the cross-sectional study before, or maybe you have read the published articles of the cross-sectional study. So cross-sectional study is also known as the prevalence study, because cross-sectional study can investigate the prevalence. So here, the difference between the prevalence and incidence. Incidence, we usually include the new cases, newly identified cases or occurrence. But for the prevalence, we include all the old or existing cases, existing condition, plus new cases. So this cross-sectional study tried to investigate the prevalence. So what is prevalence? If you would like to investigate the prevalence of the outcome, any condition, for example, the prevalence of the diabetes in a defined population, then we can use the cross-sectional survey. Or otherwise, if we would like to identify the prevalence of exposure factor, then we can still use the cross-sectional study. So the aim of the cross-sectional study is it is aimed to determine what is happening right now in the defined community. So we would like to find out the prevalence. Okay. So as I mentioned before, cross-sectional study can be designed as a descriptive cross-sectional study or analytical cross-sectional studies. Okay. So descriptive, we'll start with the descriptive cross-sectional study. So in the descriptive cross-sectional study, sometimes it is also known as the population survey, right? One of the methods is population survey. So if we would like to conduct a descriptive cross-sectional study, first, we must define the population. For example, if I would like to conduct a cross-sectional study at my region, I have to define the population. So currently, I'm living in Malacca. So probably my defined population, maybe the people living in Malacca. So we must have the defined population. And we will like to determine what is the magnitude and distribution of the disease or of the outcome. So if we conduct the cross-sectional study, you will get the answer for these 4 WH questions. What is happening right now? Okay, who are suffering from the disease? Is it adult population, pediatric population, or elderly population? Where is happening right now? When does it happen? So the answer for these 4 WHO questions can get it from the descriptive cross-sectional study. So basically, we can get the disease frequency as well. Okay, so when we conduct the cross-sectional study, whether it is the descriptive or analytical study, we collect the data at one time point, single time point. We do not need to go for the follow-up. We do not need to compare the different groups in the descriptive studies. So, okay. I'm just wondering how many of you like taking the photograph, right? So if you look at this photograph, you may see a lady holding the camera, and then she's wearing the hat, and then you may see the background, right? Sunflowers. So similar to that photo, right? We usually say that conducting the cross-sectional study is like taking the photograph because you can capture the information at one time point. You may capture the outcome information, you may capture the other factors, exposure factors at one time point. So we usually say that conducting the cross-sectional study is like taking the snapshot from the defined population. Okay, so let me start with the example of a cross-sectional study. So in the study, they would like to determine, researchers would like to determine what is the prevalence of malnutrition in a defined population. So let's say the population in that defined area is around 10,000. So basically, it is quite difficult to collect the data from each and everyone in the population. So therefore, what we usually do is if we would like to conduct a study first, we calculate the sample size. After that, we collect the sample from that defined population and we collect the data. So then we calculate, let's say example, we collect the sample of 200 from that population. Then we collect the data from the 200, and among 200 respondents, we found out that 20 families, 20 children are malnourished. So the prevalence of malnutrition among the children in that defined population is around 10%. So this is the example of cross-sectional study. Okay. So as I mentioned before, if we think the previous example, the outcome measure we would like to know is about the malnutrition. So what is the prevalence of malnutrition in that defined population? But for the cross-sectional study, as I mentioned before, it is like taking the photograph at one time point. So not only the outcome variable, we can also collect the data which might be interesting. For example, like exposure factor, how many of the family are using the unsafe water supply? How many of them are having the inadequate sanitation, sewage disposal? How about their family income? Right? So how many are low family income? How many are middle? How many are high family income? How about the diseases? If these children have any underlying diseases or congenital diseases, so maternal factors such as the low literacy of the maternal right, education level. So we can also collect all the exposure variable, outcome variable at the same time point. So in the cross-sectional study, right, we can assess both of the exposure variable and the outcome variable simultaneously at single time point, and we can investigate what is the prevalence of these factors. So the previous diagram, as I mentioned in the previous diagram, if we would like to know the prevalence of the malnutrition, malnourished children, yes, you can calculate from the findings. And if we also would like to know how many of the families are using the unsafe water supply, then we can also get it from that survey. And if we would like to know how many of the mother is having the low literacy, we can also get it from that survey. But as you can see here, we can estimate the prevalence of the exposure factor, other factors, outcome factors. However, we do not compare as a two group. So this is the overview of descriptive cross-sectional study design. Okay, so this is the explanation of what I've discussed before. The population is defined. We must have a defined population for the cross-sectional study, and then we will collect the data. So when we are collecting the data, we will collect the presence and absence of the exposure factor of our interest, or presence or absence of the disease or outcome of our interest. But normally in the descriptive cross-sectional study, there is no comparison group. We do not compare two groups, 2 or 3 groups. Okay. So before moving towards the analytical cross-sectional study, so I would like to go a little bit deeper about the prevalence. Right? So as I mentioned before, prevalence means we include all the existing cases, old cases, and we include the new cases. So these prevalence can be defined into two. The first one is the point prevalence. So for example, if I ask my respondent, do you have asthma currently? At the time of data collection currently, then this is the question about the point prevalence. So point prevalence is we ask the question, we collect the data in a one time point at that specific point. So it is the number of all current cases, including the all old cases, new cases of the disease at a time point in a defined population. So if we would like to calculate the point prevalence, right, it is the numerator is the number of total cases divided by the estimated population at the time point, multiplies with 100. But for the period prevalence, so according to the name, there is a period. So for the period prevalence, for example, if I ask my participants, so for the point prevalence, my question may be, do you have asthma currently? But if I would like to collect the period prevalence data, I'll be asking my respondent, do you have asthma within the last 1 year or within the last 2 years? So that question is considered as a period prevalence question. So we ask that question about the prevalence over a period of time. So the formula is very similar. Period prevalence is the total number of the cases, including the old and new cases, divided by the total number of the population at the beginning of the studies, then multiplies with 100. So let's do some of the exercise for the point prevalence, period prevalence, and incidence. Okay, so I've given you the diagram here, this figure. In this figure, you may see 4 vertical lines. So each line represents the data collection at one time point. So the first time was in January 2000. The second time was in January 2001. So annually data collection. The third time was in January 2002. And the last time, the fourth time was in January 2003. So we have got 4 cross-sectional study data collection. Then if you look at these small dotted lines, the horizontal lines. So each and every line represents the tuberculosis patient, TB patient. And that the total number of population in that area is 100. And it was stable over 4 years. There is no death, no migration. So we consider that that population is stable. Total number of the population is around 100. and they would like to look for the tuberculosis in that defined population. So, okay, so the first question is, what is the prevalence of tuberculosis in January 2000? So the first cross-sectional study was in January 2000. So you may see that. So each dotted line represents one case of tuberculosis. So this is the beginning of the disease. And then when the dotted line ends, there are two possibilities. The patient may be complete cure, or the patient already expired, maybe died. So that duration represents for one patient. So you may see that many cases. So these 5 cases already contracted with tuberculosis before the study. So when we do a cross-sectional study, we can capture these 5 cases. So if we would like to calculate the prevalence, so it is 5 out of 500. Right? If you would like to calculate percentage, you can multiply with 100. So that is the prevalence of tuberculosis in January 2000. So the question is asking only for one time point. So it may consider as a point prevalence calculation. Okay, so we'll use the same figure, same scenario. Okay, but the question is different. What is the incidence of tuberculosis from January 2000 until January 2003? Okay, so when we look at the word incidence, we may consider to include only the new cases, right? As we discussed before, at the beginning of the study, 5 people in that population already contracted with tuberculosis. So we may consider these 5 as whole cases. Then starting from January 2000, how many new cases developed over 3 years' time? So we may count here 5 cases, 10 cases, and then 15 cases. So we have got new 15 cases over that time. That is for the numerator. How about the denominator? So we need to consider for the denominator as well. So the total number of the population in that region is 100 initially. But if we look at the first question, they did the cross-sectional study at the beginning, 5 already contracted with the disease. So these are considered as the old cases. Then if we would like to calculate the incidence, the denominator is also free, should be free from the disease. So we cannot use 100 as a denominator in our incidence calculation. So if we want to know the incidence, initially the population should be free from the disease, and then we calculate among that disease-free population how many develop the new infection. So that's why the calculation, incidence calculation may be 15 new cases out of 95. So that's why when we are calculating the incidence prevalence, we need to consider the numerator as well as we need to consider about the denominator. Okay, so another similar question. But in this scenario, we are asking what is the period prevalence of tuberculosis from January 2000 until January 2003. So within that period, 3 years period, how about the prevalence? So prevalence means we may include all the cases. So 5 existing cases plus 15 new cases. So the total numerator is 20. Then as we are calculating the prevalence, we can include the total population in our calculation. So it may be like 20 over 100. So these are the difference between the point prevalence, period prevalence, and then incidence. So, okay, this is the example of the question when we are asking the respondents. So if we would like to ask about the point prevalence, so we may synthesize our interview question as, do you currently have asthma? If we would like to ask about the period prevalence, we may synthesize our question as, do you have asthma or have you had asthma during the last 1 year, last 2 years, or last 3 years? So it depends on the condition of the disease. So if you read the research article, from time to time, you may see that the articles report the prevalence, but they do not detailed mention about whether they measure the point prevalence or period prevalence. But this is for you to understand about the different question. Okay, so another thing we need to aware is that these prevalence surveys are more suitable for the diseases with longer duration. So I have show you the example here. So in this example, you may see that January, February, March, April, May. So these are the different timeline. It is according to the month, and it is the defined region, region A. And these small arrows, they represent a single case with short duration of disease. So for example, the flu, the duration of the disease is only 3 to 4 days, maximum 5 days, or maybe diarrhea, 1 to 2 days. So if the disease is the short duration, it will be like that. And the researchers would like to conduct a cross-sectional study at the end of the March. Can the researcher capture any case? Or no. So that's why sometimes we need to aware that it is more suitable to collect data about the longer duration of illnesses. Because if the duration is shorter, sometimes we might miss a lot of cases in our study. So now I'm moving forward to the analytical cross-sectional study. So in the previous descriptive cross-sectional study, we tried to investigate the prevalence, but we do not compare two groups. But in the analytical cross-sectional study, the process is the same. We collect the data at one time point. We collect about the exposure information. We collect about the outcome information. Then we will compare two groups. Okay, so this analytical cross-sectional study design examined the relationship between the disease and other variables of interest in one particular time point. So all are the same. It is a very simple form of the observational analytical study design. So it is also known as the prevalence studies. And then the data collection is at one time point, and it is like taking the snapshot from the community. But the difference here I have highlighted. So we collect the data from the population. Then we try to compare two groups, and we try to find out if there is any association between these factors and the outcome of interest. So as I mentioned before, it is useful for the chronic diseases rather than the short-lived diseases. So as an example, so in the previous example, from the whole population, we collect the sample, we calculate the prevalence. How about in the analytical cross-sectional study? So from the whole population, we will recruit the sample. So from the sample, we will collect the data. After data collection, probably we may divide, we may separate into two groups. It may be based on the exposed group, non-exposed group, or it may be based on the disease group, non-disease group. So this division was not predetermined, because we do not know initially at the beginning of the study, we do not know yet how many are exposed, how many are not exposed. We do not know yet how many are having the disease outcome, how many are not having the outcome. So after the data collection analysis, we start to separate and compare these two groups. So for example, from the exposure group, then we will calculate how many of them in the exposure is having the outcome disease, how many without disease. So same to the non-exposed group, we will do the analysis. How many of them are having the outcome disease? How many of them are not having the outcome disease? Then we can compare these two groups. So or otherwise, we may compare based on the disease group and non-disease group. This is also not predetermined. Initially, we do not know yet how many of them in my sample is having the disease. So after the data collection, then we will compare these two groups. So if we compare according to the disease and non-disease group, then in the disease group, we will look at how many of them are exposed to that factor, how many of them are not exposed. Similar to that, in the non-disease group, we will compare how many are exposed, how many are not exposed. So that is the difference between the descriptive cross-sectional study and analytical cross-sectional study. So descriptive, no comparison group, analytical study, analytical cross-sectional study, we try to compare the groups. Okay, so let me continue with a practical example. So the study was conducted between among the people in the Thai-Burma border. So in that, I'm not sure in Indonesia, in our country, in Myanmar, we usually use the bunny mosquito coils. So the student, have you ever seen the bunny mosquito coils? So we ban that mosquito coil. It may have some fumes, insecticide, and later the scientists found out that it can cause some of the respiratory tract infection and allergic reaction, etc. So they consider as that is the end of air pollution. Nowadays, we are not using it anymore. So, but at that time, the people in the Thai-Burma border, so sometimes the migrant population, they are using that bunny mosquito coils. Then what happened? So researchers would like to know whether their usage of penny mosquito coil associated with the respiratory symptoms such as the wheezing, cough, shortness of breath among the children in their family. So then they try to conduct the analytical cross-sectional study. So for example, the sample, the population. So the population must be defined population. So the families, the people living in that time Burma border. Then they calculate the sample size, and they recruited the samples by using the simple random sampling. Then gather the data about the usage of the mosquito coil, the respiratory symptoms. After the data collection, then they separate into two groups. So some families, they may use the penny mosquito coils. Some families, they may not use the penny mosquito coils. Then in the analysis, we try to find out how many of them use the mosquito coils having the respiratory symptoms, how many of them do not have the respiratory symptoms in the exposed group. Similar to that, in the non-exposed group, they try to identify how many of them, how many of their family have the children with the respiratory symptoms, how many do not have. So in this example, they try to compare the exposed family, exposed to the penny mosquito coils families, and then another one is the non-exposed group. So then, second example. So the second example is that researchers would like to identify the association between the osteoarthritis and obesity in region A. So let's say this is the defined population region A. Then from that defined population, the sample of 100 is collected, recruited, and then the researchers collected the data by using the questionnaire, right? By measuring their weight and height to calculate the BMI, by conducting the clinical examination to identify the osteoarthritis. So during the data collection, they collected all this information. That's why majority of the cross-sectional study, we use the questionnaire. We give it to the respondents, and then it will be the self-administered questionnaire, or otherwise sometimes we interview to the respondent to fill in to get the answer for questionnaire. So in addition to the questionnaire, we can also do the clinical examination during the data collection time if our outcome is related to the clinical finding. We can also conduct the physical examination, weight, height measurement, and sometimes you can also do the laboratory test. For example, we would like to check the serum blood glucose level or otherwise cholesterol level, then we can still do the laboratory test during the data collection. So the data collection process of the cross-sectional study is not only for the questionnaire, but also include the clinical examinations and laboratory tests. So then after the data collection, so they try to separate into two groups, disease group and non-disease group. So who are in the disease group? The people with OA, osteoarthritis, they are in the disease group. And another group is the people without osteoarthritis, they are in the non-disease group. Then analysis, we compare these two groups. How many of them in the disease group are obese? How many of them are having the normal BMI? Or how many of them, similar to that in the non-disease group, how many of them are obese? How many of them are having the normal BMI? So these are just the examples of comparison between the groups in the analytical cross-sectional study. So some of you may be familiar with this 2x2 table. So this is also known as the contingency table. So in the 2x2 table, it has been used in the case control study, cohort study as well. So we keep the outcome at the column and we keep the exposure factor at the row. So the total sample in that study was 100, for example. Then we need to clearly key in all the cells. So among the sample, after the data analysis, the researchers found out that 47 out of 100 are in the disease group. Then disease group may be 100 minus 47, 53. So then they separate into two groups. One group is the disease group, one group is the non-disease group. Then among the disease group, how many are obese? 35. Then if we would like to know the non-obese in the disease group, we minus 35 from 47. Then we have got 12 in this group. So, and then in the non-disease group, the total is 53. Then we would like to know how many are obese. Okay, 11 are obese. Then if we would like to know the non-obese, normal BMI, then we can minus 11 from 53. So we have got 42. So the total number of the obese people are 46 and obese 54. So if we can key in correctly to the 2 by 2 table or contingency table, then we can easily proceed for the calculations and interpretations. Okay. So this is just a briefly discussion about the data analysis. So as I mentioned before, we need to key in the cells A, B, C, D according to the information we get it from the survey or data collection. Then we can compare. In order to determine whether is there any association between the exposure and disease, then first we can compare the prevalence of disease in the exposed group and the prevalence of disease in the non-exposed group. So if we would like to compare the exposed group, for example, the exposed group here is A plus B, the total number of people in the exposed group. And the total number of people in the non-exposed group is C plus D. So we are looking at the horizontal row. Okay. Then among the exposed group A plus B, how many of them are having the disease A? So A over A plus B versus among the non-exposed group, how many are having the disease C over C plus D? So if you compare the exposed and non-exposed group, you can compare the prevalence. Or otherwise, if you would like to compare the disease and non-disease group, yes, you can still compare. Disease group total is A plus C. And non-disease group total is B plus D. So then we will compare the prevalence in each group. Prevalence of the exposure in the disease group is A over A plus C, and then compare with B over B plus D. So we can compare the prevalence of the disease or prevalence of the exposure into groups. So the next step I do not include here is you can also calculate the odds ratio in order to identify the association between these factors. Okay, so this is the analytical study and experimental study. Right? So as I mentioned before, if we would like to conduct the cross-sectional study, we can identify what is the prevalence of the condition, prevalence of the exposure, prevalence of the outcome. So we can get the prevalence data. So how about the cohort study? Do you still remember the cohort study discussion? So what kind of information, what kind of data we can get from the cohort study? Is it the prevalence data or incidence data? Have you all still remember that? Incidence data, isn't it? Because in the cohort study, initially, the population is free from the disease. Ideally, they are free from the disease. From the exposure group, non-exposure group, we follow up, then we identify the outcome. So similar to that, in the experimental study, initially, they are free from the condition. There is one group assigned intervention, another group is a control, or maybe treatment A, treatment B, and then we look at the incidence of the outcome. Okay, so how about the case control study? So case control study is not included in this lecture series, but as an overview, for example, like case control study, according to the name, we recruit the cases, we recruit the controls. Then we ask the past exposure about the risk factor or maybe any associated factor. So in the case control study, for example, I recruited 100 cases. Okay, so for example, like breast cancer, I recruited breast cancer 100 cases. And then the control, maybe the patient or the woman free from the disease, 100 controls. Then I asked the previous exposure to the HRT, I asked the previous exposure to the, so any hormonal treatment, I asked the previous exposure, previous history of the breastfeeding, etc. So I asked the past history. But this 100 cases I recruited for my case control study is not related to either incidence or prevalence. It depends on the sample size calculation. So we calculate the sample size and we estimate, okay, so 100 in the cases, 100 control may be enough to answer my research question. So that's why if we conduct the case control study, that number, that data may not provide you any information about the prevalence or incidence. Okay, so that is the difference between these study designs. So cross-sectional study, yes, we collect all the prevalence data. Cohort, we can estimate the incidence data, we can calculate the risks. Experimental study is still the same, we can look at the incidence of the outcome. But for case control study, we cannot identify either incidence or prevalence data. Okay, so This is the middle of my presentation. So far we discussed the analytical cross-sectional study and then a descriptive cross-sectional study. So I'm just wondering if some of you would like to answer this question, maybe a few students, 2 or 3 students. What is the single most important point you remember so far from our discussion? I'm glad to hear from your side. Any students? Is there any point you remember so far? Okay, so please don't worry, there is no right or wrong question, right? Or no right or wrong answer. So whatever you remember, you can say, ma'am, I only remember the cross-sectional study. And that is also okay. So what do you remember so far? My students?
Excuse me.
Yes?
Um. Uh. What? My God. The important point that I remember is cross-sectional study is study for prevalence rate. Prevalence.
Okay, thank you very much, Dr. Zahra. Am I calling your name correctly? Yeah, thank you very much. Yes, correct. So the cross-sectional study mainly try to identify the prevalence. So thank you very much. So is there anyone would like to try any point?
Maybe in the cross-sectional study, in descriptive study, the difference with the cross-sectional in analytic study is in the analytic study we compare two groups, but in descriptive study, cross-sectional doesn't compare any groups.
Yes, thank you very much, Dr. Ning Ning. Am I calling you correctly? Yeah, thank you very much for your attention. Yes, correct. For the descriptive study, we mainly investigate the prevalence, but we do not compare the different groups. But in the analytical cross-sectional study, we try to compare two groups. Okay, thank you very much. So one thing here the student usually confuse is the difference between the analytical cross-sectional study and the case control study. So in the case control study as well, they compare the two group, cases group and control group. But in the analytical cross-sectional study, we do not know yet how many in each group. We collect the data. Based on the data finding, then we divide into two groups and we try to find out any association. But in the case control study, the disease already occur, the exposure already occur, and we have the defined number in each end in cases and control, and we ask the previous exposure. Okay, so thank you very much for your active participation and answering the question. So, okay, so now I would like to move forward. I stop for a few minutes. I would like to move forward the practical aspect of designing the cross-sectional survey. So, in that case, right? So if we would like to design any study design, first of all, we must have the research question. So what is the topic of interest? Then we need to formulate our own research question. Based on that research question, we will try to find out the answer for our research question. So first step, so we'll go detail later. Then we need to consider, okay, my research question is this. And then I have selected to conduct as the cross-sectional study. So for example, descriptive cross-sectional study. Is it appropriate? We need to ask to ourselves. Our researchers need to ask to ourselves. For example, my research question is, I would like to identify whether the physical activity, whether the treatment A is effective as a treatment B to treat the CA bladder. So we have the conventional treatment that we are using the treatment B, but the scientists discovered treatment A. So we would like to know which one is more effective. Then cross-sectional study may not be the best choice. If there is any intervention, we would like to try the effectiveness of anything, then we may go to the experimental study design, maybe the RCT or quasi-experimental study. Then if my research question is, I would like to identify the incidence of, for example, the incidence of lymphoma among the radiation exposure group. If I would like to identify the incidence, then cross-sectional study may not be the appropriate design. So then I need to choose the cohort study. So, but if I would like to identify the prevalence of the disease in a specific community, defined community, then this cross-sectional study is appropriate for my study. So that's why first we need to formulate our own research question. Then we need to consider what might be the best study design. Okay. Then you need to consider who are you going to study, in which area, what population. For example, if my research question is related to the medical education, then my study population will be the students or the teachers. If my research question is related to the patients, then my study population is maybe the patients in the community. So we need to define who we are going to study and how to collect the sample. So actually sampling maybe like another lecture. So we need to choose the appropriate sample size based on a sampling process, based on the research question, based on the population, based on the availability of the sample. And then another one is we need to aware about the bias in all the study, not only the cross-sectional study, cohort study, case control study, we need to aware about the bias. And then how are you going to collect the data? Right? Then before starting the study, we also need to plan how we are going to analyze. Are we going to analyze only for the prevalence, or are we going to analyze if there is any association with these exposure factors and the outcome? Okay, so these are the 7 questions we need to think in advance before designing the cross-sectional study. So I'll go through that by using the example research. Okay, research question. So what is the research question? If I think about any problem, it may be related to the health, it may be related to the behavior in the community, it may be related to the treatment, it may be related to the medical education field. So I need to select that topic and I need to clearly describe the research question. Of course, based on the research question, based on the topic, we also need to go through the literature before studying the data collection. Why we do the literature review? Because we would like to know if what is so far, what has been done on this topic? What are the findings so far on this topic? If the study is recently conducted in my setting, the same topic, then I may not repeat twice. So that's why we need to clearly define our research question. We need to go through the literature. We need to identify whether the area I would like to test in this study is still a gap or not. Then from the research question, we need to formulate the specific aim and objective that we would like to achieve from our study. So when we write our research question, we usually use this PICO, P-I-C-O, we say the abbreviation. So PICO means we include the population. What is the population? How about our participants, the students population or the patient or the healthy community, healthy population in a defined community, in a defined population? Or otherwise, is there any issue, any health-related issue or any intervention? Of course, in the RCT, experimental trial, we need to include what might be the intervention. And then C is there any comparison group, control group, or what is the context? And then O is the outcome. So we consider all these 4 and we formulate the research question. So in this example, my interest is related to the breast cancer. So in Malaysia. So if I look at the data about the breast cancer in Malaysia, the trend of the breast cancer is increasing. So when we compare the 2 national cancer report, it was previously estimated each standardized rate was 31, and then it increased to 34 out of 100,000 women in the population. So it is an increasing trend. And then I also checked the mortality every year. It is also increasing trend. So I'm just wondering why the mortality, the incidence of breast cancer is increasing in our country. Then I look at, is there any way to reduce it? And I found out that the Ministry of Health is published a guideline. So the women over 40, they should undergo the screening procedure. So for example, like mammogram or otherwise the clinical breast examination. So these are the things I found out from the literature review. But then what I would like to know is, I would like to know how many in our population is aware of the symptoms, how many are using the screening, how many are having the barriers, difficulty to use the screening. Then I define a population. It is a district in Malaysia, Battling district. So then I break down. So if you look at the research question, I have the study population, the issue, and then the outcome that I would like to know. So these are the objective to determine the awareness, to determine the utilization rate, to determine the barriers. Okay, so these are the research question and research objectives. So similar to your project, if you would like to start your cross-sectional study, first, you need to select the topic, construct your research question, try to identify the literature. Then you may write down the specific objective that you would like to achieve for your study. Then second, you need to think whether the design is appropriate or not. So as I mentioned before, if you would like to test any experiment, then it may not be appropriate. For example, I would like to test whether the chocolate consumption is associated with the short-term memory improvement. So chocolate consumption is like a assigned intervention. Then outcome is the short-term memory improvement. In that case, I may not use the cross-sectional study. I will go for the RCT. Right? So that's why we need to consider carefully what is the best study design, right? Appropriate study design. So in my example, I would like to know the baseline awareness level about the cancer signs and symptoms, baseline utilization rate, and to identify the barriers. So it is like collecting the prevalence data or information from the community without any intervention. So then I have to, and then I do not want to compare different groups. So I have selected descriptive cross-sectional study design. So similar to that, in your project, if you would like to, okay, I would like to know the prevalence, and I also would like to know the factors associated with that. Then you may change to the analytical cross-sectional study. Then who are we going to study? So as I mentioned before, I decided the defined population, for example, like the Patlin district. So this is the area there. And then we also need to consider how are we going to recruit our sample. So ideally collecting the data from everyone in the community is the FAT. So we are taking from each and everyone. But in reality, we cannot go and collect the data from each and everyone, right? So except for the census data, the national data, they may recruit, they may collect from individual, each and every individual in the household. But for the research, generally, we cannot collect the data from the whole population. So we have to define our sample. So for the sample, first we need to calculate the sample size. So sample size may depends on the population, the total number of the population, margin of error. So sample size, you can use the various sample size calculator. So sample is the subset of that defined population. After calculating the sample size, you need to consider how am I going to sample my respondent. So there are different ways of sampling methods. For example, like probability sampling method, right? Random sampling, or non-probability sampling method, non-random sampling. So you may decide which sampling method is applicable to you. Sample size calculation. Okay, and we also need to consider inclusion and exclusion criteria. Who do you want to include in your study? Who do you want to exclude in your study? So these are the things you need to consider before recruiting your sample. Okay, so as a practical aspect, so I calculated the sample size and it is around 900. And I have decided, okay, I know the defined population. I have the household list. So we can get it from the Department of Statistics in KL, Putrajaya. So from there, I got the household list and then we randomly select the household. So it is like random sampling from that area. Okay, then when we got the household list, we have the random household list. So we need to go and visit that household to collect the data. Then who should we include? Who should we exclude? So we need to think carefully about the inclusion and exclusion criteria. So for example, like our topic is related to the breast cancer. Should I include the male respondent? I'm thinking, because yes, breast cancer can occur in the male population as well, but the incidence prevalence is very low compared to the female. So majority of the cancer patients are female. So I have decided, okay, to target to the female population, woman population. And then the screening process is usually recommended for the woman 40 years and above. So I've decided, okay, I would like to know how many of women 40 years and above, they get the recommended screening. So my inclusion criteria is set up as a woman 40 years and older, those who are living in that district. Of course, I'm not going to recruit the visitor from the different places because I would like to know the saturation in that area, who are able to speak either in English or Bahasa and can answer the question independently. So similar to that, when you plan for your cross-sectional study, you need to consider who should we include in our survey. Only the male or female. Another one we conducted is related to the CRC, colorectal cancer. But for the CRC, we recruited both of the genders, male, female, 50 years and above. Right? So that's why we need to consider who we need to include, who we need to exclude. Another one is exclusion criteria. So sometimes the students confuse and they just write opposite to the inclusion criteria. For example, the woman will be included in our study, so we will exclude the male. So exclusion criteria, they write the male. Exclusion, they write the woman age less than 40 years. But actually, the exclusion criteria should not be the opposite of the inclusion criteria. Because inclusion criteria you already define, it is not that much useful. We write the opposite for the exclusion criteria. So, for example, exclusion criteria here, I set up as, I will not recruit the healthcare personnel because their awareness level, knowledge level might be different from the total population, general population. So I excluded them. I assume that their awareness level is already high. And another one, I will exclude those who already had the breast cancer, the survivors, I will not include because they already gone through all this process. So their knowledge may be totally different from the general population. So that's why you need to think carefully, who do you want to include, who do you want to exclude? So as I mentioned before, exclusion criteria should not be opposite to the inclusion criteria. For example, like if you would like to do some, if you would like to take some blood tests from the respondent, then you may exclude for those who are having the bleeding disorder. Because if you puncture and if they have any problem, right, it might harm to the patient. So you need to consider the exclusion, inclusion, and exclusion criteria based on your research topic. Okay, another one is we need to consider about the bias as well. So probably selection bias, if we do not select the respondent properly from the defined population, it can lead to the bias. So we would suggest to use the probability sampling, random sampling from the population. So how to collect the data? Everyone know that we can collect the data. That is a commonly used method. We collect the data by using the survey questionnaire. So for your topic, if there is any existing questionnaire, the other researchers already prepared and validated, you may use it. Or otherwise, if you would like to modify, if you would like to develop your new questionnaire, then it is also fine. So how to collect the data? You may do the face-to-face interview. It means that you go to and visit to their place, collect the data by interviewing them. Or otherwise, in the Western countries, what they did, they sent the questionnaire through the mail, and the respondent need to fill out and return back to the researcher. So that is the mail questionnaire. And the third one is the just calling a telephone interview. Or otherwise, sometimes the student use the self-administered questionnaire. So it means that they prepare the questionnaire, they give it to the respondent. We do not interview them, so they fill it by themselves. Or otherwise, if necessary, like medical examination, so measuring the weight, height, BMI, or otherwise, if we may need to withdraw the blood test, right, to get the information, for example, RBS, right, lipid level. So we can do all these methods. So at this moment, what is most popular is we are doing the online survey questionnaire. So because of this movement control order COVID-19, we changed to the self-administered internet-based questionnaire. So that is quite popular method at this moment. So for us, what we did use the pre-existing questionnaire. It was validated, and we get that. If one thing we need to aware is, if we would like to use the previously validated questionnaire, you need to check whether if there is any copyright or not, and you need to get the permission from the original developer. We need to credit them. So for us, we use that Beacon, and it. Of course, our setting is in Malaysia, so we modified that questionnaire to be applicable in Malaysia because the screening guideline in the UK and then Malaysia is different. So modify, we translated. So similar to that, if you want to modify the questionnaire, yes, you can modify, you can culturally adapt to your setting. So data collection methods, for us, we did the face-to-face interview. Of course, more than 900, we are not able to go, only the researchers are not able to go from house to house. to collect 900 respondents. So we hire the research assistant and we provide the training them how to conduct the interview, how to collect the data. So then from house to house, we go and collect the data. Okay, plan for the analysis, right? So before doing the data analysis, so you need to carefully think about the quality of your data. So nowadays we are using the online, especially the Google form questionnaire. That is very convenient because you just download the Excel file and you can change to the coding. So you will automatically get the soft copy of the data. But if we use the paper-based questionnaire, we need to transfer the data from the paper into the data matrix, data sheet, maybe the Excel file or maybe the SPSS data sheet. So at that time, the error can occur, the typing error, the data entry error. Right? And then we also need to check the distribution of the data. So in order to improve the accuracy, first one person enter the data. And then another independent researchers enter the data and we compare this finding. For example, the first person enter code number 1, and the second person enter the answer as a number 2. There is a discrepancy. So in that case, we need to check back the paper and whether the correct answer is number 1 or 2. Right? So that is to improve the quality of the data as well. Then for the data analysis, so if it is the descriptive cross-sectional study, we may present our finding as a mean, median, measure of the central tendency or measure of the dispersion. And we can also calculate the prevalence of the exposure, prevalence of the outcome factors. Okay, so in our study, we calculate the percentage prevalence of the awareness for the cancer symptoms. So as you may see here, LAMP symptoms, LAMP as a sign of breast cancer, majority of them aware of that. So 88%, 81% bleeding, they are aware of that. Okay, if these LAMP are bleeding, then they recognize they are the breast cancer, so they may go and seek for the healthcare. But breast cancer may also present with the other non-LAMP symptoms. So for example, the rash, changes in the skin, nipple inversion, approximately half, more than 40% they did not aware. Only 57, 51% are aware of that. So generally, what we know from that study is, okay, in that defined population, the symptoms, LAMP symptoms are commonly aware, but they still need to improve their awareness on the non-LAMP symptoms. Okay, so that is the first thing. Then how about the uptake, our second objective? Approximately only 1/3 right, had the clinical breast examination, 1/4 had the mammogram. So actually it should be more than 70%, 80%. So the screening uptake should be improved. Then we look at what are the barriers preventing them go and seek for the healthcare. So you may see that the highest prevalence is 39.6, so approximately 40%. 4 out of 10 women, they consider that they are afraid what the doctor might find out. So it means that they are afraid to get the diagnosis. So because sometimes they say that they don't want, even though they have the cancer, they don't want to know the diagnosis because they consider cancer is the death sentence. So we need to change the perception from the community. If you go and seek help early, yes, your survival is better. So we need to convey that information. So this is the brief finding of our study. So now let me conclude the discussion with advantages and drawback mitigation of the cross-sectional study. So actually cross-sectional study is very useful to investigate the initial problem in the community. So we can conduct within the short duration. Maybe within 2 weeks, if the sample size is large, within 1 month, we can collect the data because it is a one-point data collection and we can get the quick result. Compared to the RCT, compared to the follow-up, 5 years, 10 years cohort, relatively cheaper. It is quite less expensive. And as I mentioned before, if we are new to the problem, we can know the initial overview, what is happening in the community. Then from that, we can propose the hypothesis. So, okay, another one is sometimes we can also use this cross-sectional study as a beginning point of the prospective cohort study. So you may know that in the cohort study, we follow up from the exposure to the outcome. But that follow-up group should be free from the outcome condition initially. So what they usually do is they start, it is called the hybrid design sometimes. Hybrid design means they start the cross-sectional study, excluded all the pre-existing cases, then from the disease-free population, exposure group and exposure group, they follow up. So it may be used as the starting point in the prospective cohort study for screening out already existing conditions. Then we can also identify the association between the multiple exposure factor outcome at the same time point. Of course, definitely stronger likelihood to recruit the participants. So now this the question, the problem is the non-respondent. Even though we would like to get the sample size of 900, 1000, sometimes we may not get it. Right? So we need to get the consent from the respondent before collecting the data. Sometimes they don't want to participate. Especially it is worse and if they need to come back for the follow-up or if we need to go there frequently to collect the data. So that's why cross-sectional study is the benefit. The participants are more likely to participate because it is one-time data collection. We are not coming for the follow-up. Okay, so there are many advantages of conducting the cross-sectional study, but of course, every study design has the limitation. The first one, we call it the exposure factor, we call it the outcome factor, but we cannot establish the temporal relationship. So it means that ideally the exposure should come first before the disease. And then we cannot estimate how long does it take from the exposure to the outcome. All this information, we cannot get it from the cross-sectional study. Of course, we cannot get the incidence data, we cannot get the causal relationship. So we can only identify that exposure factor and the outcome are associated or not. We cannot identify whether this exposure factor can cause the disease. We cannot get it from this cross-sectional study. And no incidence rate. If you would like to get the incidence rate, probably we may refer for the cohort study. Yes, increase bias potential. Yes, selection bias potential is there. And we may overcome by recruiting a random sample from that defined population. And if the disease of our interest is short duration, we do the cross-sectional study, sometimes we might miss the disease. And we might miss that cases. And insufficient for the rare diseases. For example, we would like to know the prevalence of the genetic, very rare genetic disease, and we would like to find out, is there any factors associated with that? Then if the disease is very rare, very difficult to get the finding. So if you would like to identify the rare disease and their associated factor, then we might recommend to use the case control study. Okay. So in order to recap, right, what we have discussed today, so we discussed about the descriptive cross-sectional study. So it means that we will collect the data at the same time point. We will collect the outcome disease, exposure factor, like taking the photograph, right? Then we may not compare. And then we also need to know about the point prevalence, period prevalence within that period. And then we continue our discussion about the analytical cross-sectional study. So the same process, we collect the data at the same time point, but we try to compare according to their exposure factor or according to their presence or absence of the outcome. Then we compare the prevalence of the prevalence in each group. Then when you design the cross-section study, you may need to follow these 7 steps. So first, identify your research question, go through the literature, set up the specific objective, and consider whether your research question is appropriate to conduct as a cross-sectional study design. Then you need to define your population, you need to calculate the sample size, you need to determine how to select your sample. And then, of course, we need to be aware of the bias, right? Selection bias. And then we need to decide what tool we would like to use for the data collection, what method we would like to carry out for the data collection, and then data entry, data cleaning, and then proceed for the plan for the analysis. Okay, so these are the references for our discussion. So thank you very much for your attention.
Thank you, Dr. Mila, for the very interesting and clear presentation. So we go on to, I think I don't need to resume because Dr. Mila Nunute has so clearly resumed the presentation. But I underline, highlight your statement about the exclusion criteria is not the opposite of inclusion criteria. It's very interesting because common mistakes that we as a researchers do the mistakes. Now we go on to the fourth session about questions and discussion. So I want to open the question session. Maybe there is questions for the floor, the medical students, or from my colleagues in Muhammadiyah University of Surakarta, please. Maybe, okay.
Thank you for the opportunity, Dr. Indri, and thank you for Dr. Mila for this good lecture. My name is Firda, and my question is how to reduce selection bias in cross-sectional study. I mean, what is the easiest way to reduce the selection bias? Thank you.
So thank you very much for the very important question, Dr. Frida. Selection biases usually occur in the study designs like cross-sectional study, case control study. So one of the way to reduce the selection bias is to consider the appropriate sampling method. So if we have the defined population and if we select the respondent randomly from that population, then that is one of the way to reduce the selection bias. And another one is like, this is also considered as a selection bias that I'm not sure whether we haven't discussed about this, incidence prevalence bias. So in the cross-sectional study, we are only collecting the data about the prevalence. So sometimes if we would like to identify the association between the exposure and prevalence data, then it might lead to some inappropriate finding. So in that case, for example, like a study was conducted to identify the association between the smoking and Alzheimer's disease as a cross-sectional study. It was conducted before in the Western country. And they found out that smoking reduced the prevalence of Alzheimer's disease. And that finding, based on the previous knowledge, it was not appropriate. What the researchers did is, after the cross-sectional study, they continued the group as a cohort and continued the study for 3 years follow-up. Then final result came out that because of the final result is that the smoking can increase the occurrence of the Alzheimer. So because in the cohort study, we get the actual incidence data, but in the cross-sectional study, we get the prevalence data. So if we would like to find out the real association, it is better to use the incidence data as well. But basically, how do we reduce the selection bias is we use the random sampling method, probability sampling method to reduce the selection bias. I hope I answered the question.
Okay.
Thank you.
Yeah, thank you very much.
Okay, yeah. So the selection bias is we can arrange to the sampling method, and maybe the analytical from the analytical, maybe we. Okay, for the next questions, maybe.
Yeah.
Excuse me.
Yes, thank you.
Okay, Sarah, go on.
Okay, thank you, Dr. Indri. Excuse me, Dr. Mila. I want to ask a question. How to determine the sample in cross-sectional study? Example is random sampling. I mean, in number of the samples. Is there any certain formula, or it's up to the researchers? Thank you.
Okay, thank you very much for the interesting question, Dr. Zara. So sample size calculation is very important in all the study designs. So there are different questions, different formulas to calculate the sample size. So previously we used manually to calculate the sample size, but nowadays there are different software available for the sample size calculation. For example, the freely available software is like APM4, or otherwise we can also use the G-Power. So that sample size calculation is based on the study design. So for example, for the cross-sectional study, first of all, we need to know what is the total population. For example, my total population is 200,000. So I need to key in 200,000. We also need to know what is the estimated prevalence of the outcome. So for example, like my interest is the breast cancer. So I look at the other literature, maybe other country, neighboring country, so nearest, right, to our study. So then I look at the estimated prevalence. For example, estimated prevalence is 5%. Then we may need to key in the estimated prevalence, and we need to determine the acceptable margin of error. We usually set up 5%. Then the software will automatically calculate the sample size. But sometimes it can happen. Our topic is quite new. Little is known. So we do not know what might be the estimated prevalence. So in that case, we can set up a 50% as the estimated prevalence, and we can easily determine the sample size. Okay. When we calculate the sample size, another thing we need to consider is the non-response rate. So let's say my sample size is around 500. So I get the sample size by using the total population, estimated prevalence, margin of error, I get 500. But we need to consider whenever we approach to that respondent, they may not agree to participate. That is called the non-respondent. So what we usually do is we anticipate 20% as a non-respondent. And then we add on that number in our total sample size. So total sample required is 500 according to the sample size calculation. Then 20% of 500, maybe 100. We add on 600. So we plan to collect the data from 600, and after extracting the non-respondent rate, we will get the net of 500. So did I answer the question? Thank you.
Thank you, Dr. Mila.
Yeah, thank you very much.
Okay. The next questions.
Saya mungkin dokter.
Fahri, go on.
Okay. Excuse me, doctor. Good morning.
Good morning.
As you explained before, that designing these studies, that we need to make a restriction criteria to find a specific subject. My question is, what the important thing or what thing that we must to pay attention when choosing restriction criteria, including inclusion and exclusion criteria, just based on prevalence of disease or others, or maybe, doctor, maybe that my question.
Okay, thank you very much, Mr. Fikri. That is the important thing we need to consider before the data collection, right? So we need to clearly set up, and we cannot change after that, because we need to collect the data according to that inclusion criteria and exclusion criteria. So first of all, we may need to consider what is your research topic. Right? So research topic, for example, it also sometimes the diseases may vary across the gender. For example, my topic, it is more prevalence is more in the female, so we only included the female. So, but for the another cancer, colorectal cancer, the prevalence is common in both male and female, so we will include both. So that's why, what is your outcome disease? Another one is, how are you going to recruit and collect the data? So for example, one of the cross-sectional study conducted in Malaysia was they would like to identify the serological prevalence of dengue. So it means that they will collect the blood sample, they will check the antibody level for the dengue. So in that case, they may include the adult population. Then, of course, that data collection method include not only the questionnaire, but also the blood collection. So in that case, we may consider not to include the pregnant ladies. We may consider not to include those who are having the immunocompromised condition. We may consider not to include those who are having the hemophilia or any hematological diseases. So that's why first we need to consider what is the population, what is the research question, how are we going to collect the data. then we may decide the inclusion and exclusion criteria. So what we usually do is not only the researchers decide, we work as a team, research team, and then we discuss together what might be the best to set it up. Or did I answer your question? Or if you have anything, if you want any example, please let me know.
The feedback.
Maybe enough.
Okay.
Yes.
Dr.
Thank you,
Mila,
Dr. Mila.
Yes.
if we have the inclusion or an exclusion criteria, and then we find that our sample size is not, maybe it's not enough. Maybe when we get a inclusion, is there's very little respondents. How we can manage that?
Okay, so probably first of all, before conducting the study, we have the sample size, and then we have the inclusion exclusion criteria. Then we collect the data. So that very little sample size may be related to the non-respondent or related to the inclusion criteria. If it is related to the non-respondent, then we may try to improve the response rate. But if it is related to the inclusion criteria, probably we may not encourage to change because the previous respondents are already recruited with that inclusion criteria. And if we change in the middle of the study, then the respondent may not have the equal characteristics. So that is the thing we need to consider. But if it is due to the non-response rate, for example, my sample is 900, but I can only recruit 500. So what I will do the repeated data collection, repeated visit. But I would not suggest to amend or to change the criteria.
Okay. Because maybe in the ongoing research there is so many maybe challenge or maybe there's difficulties sometimes in the point of sample size. Maybe the next questions, please.
Might be, Doctor.
Zaid. Okay, Zaid, please. Go.
Thank you, Dr.
Afi later on.
Thank you, Dr. Indriyati. I wanna ask one question for Dr. Mila.
Yes.
My question is.
Your voice, Zaid.
Okay.
Naikin dikit.
Thank you, Dr. Indriyati, and thank you, Dr. Mila. I wanna ask one question. My name is Zaid. My question is, the first thing when we want designing cross-sectional study is make a question research. What must we do when we don't have comparator when we make a PICO? Thank you.
Okay, so thank you very much for the important question, Mr. Zahid. I really appreciate your question. Yes, actually, we need to formulate the research question before studying any study designs. So it may be the cross-sectional study, cohort study, experimental study, whatever we would like to. If we would like to start any research, we must have the research question. Then based on the research question, we will decide what is the appropriate study design. Yes, that can happen in the cross-sectional study because cross-sectional studies sometimes we may not consider the comparison comparator. Yes, we can still formulate the research question. For example, in my research question, I just try to determine the awareness level or the utilization barriers of the breast cancer in a specific time. So we include the study population and then the issue related to the breast cancer, but we do not have the comparator group. Yeah, that is still acceptable. But if you design for the experimental study, or if you design for the other cohort study, you may include the comparator group in your research question.
Okay, thank you.
Yeah, thank you.
Okay, Zaid, I hope it's clear enough from the explanation of Dr. Mila. Next, Nafi.
Yes, thank you, Dr. Indri, for your information. And for Dr. Mila, excuse me, I want to ask a question. If we have done the randomly sampling for reduce the bias potential, and then we collecting the sample, but how we do know that our data is still containing the bias if our data is still find the bias, then what should we do to handle it? Maybe that's my question. Thank you, Dr. Mila.
Sorry, Dr. Nafi, could you please repeat the question? So you select the
Okay.
data by the random sampling, yes?
Uh, to reduce the potential of bias, we can use the randomly sampling.
Mhm.
But if we have done the randomly sampling, how do we know that our data is still contain the bias or not? And if the data is still contain the bias, what should we do to handle it?
Okay, so yes, thank you very much. So for the, thank you very much for the question. Actually very interesting. There are different bias which are liable to occur in any type of the research. So selection bias, random sampling is one of the way to reduce the bias. Yes, even though we have the random sampling, there are still possibility of getting the bias and confounding factors. So first we need to consider the appropriate statistical design. So for example, like for the confounders, if we would like to reduce the confounders, we may use the modeling, statistical modelings that can reduce the confounding bias. Another one is for the missing data. So missing data, sometimes it might also affect to the interpretation. So then we need to appropriately adjust and modify, do the imputation for the missing data. So another one is, as I mentioned before, the incidence prevalence bias. So if the outcome is not that much reasonable, like if there is any suspect, then we may continue with the incidence outcome study design. For example, in that study design, they did the cross-sectional study, and then they follow up with the case cohort study. So these are the measures to find, these are the measures to reduce the bias. Of course, each and every study has the limitation. So if we cannot address by that, then we need to clearly aware about it, and we need to explicitly mention in our limitation section.
Okay, thank you, Dr. Mila. So besides we do the sampling by randomized sampling, we can use to manage the bias with the analytical statistic from the data, where we collect the data and we still find the bias. So we uh, try to find the very prompt and suitable analytical statistic. That's right, Mr. Dr. Mila?
Yes, correct.
Jadi pakai statistiknya nanti di analisa statistiknya digunakan untuk manage biasnya. Next questions maybe 3 or more questions. Is there any questions? Bu Nining, Dr. Erna, Dr. Yusuf maybe wants to share opinion here. Dr. Nining, please.
Yeah, we usually use questionnaire yeah, for cross-sectional study. If we want to use a pre-questionnaire study from other research, how should we revalidation again, Prof. Mila?
Should we refer?
Test for validation again.
Yeah, thank you very much for the interesting question, Dr. Niding. Yeah, that is the important thing. So sometimes we use that questionnaire from the other country. So the other country, the culture, the belief might be different from our study setting. So it is the best to do the validation again. And second thing, sometimes we translate into our local language. Then we may need to do the validation again. So before doing the validation, I would suggest to contact to the author to get the permission to use the questionnaire. Then you may do the adjustment, right, adaptation. For example, like the screening guideline in the other country and in my setting may be different. So in that case, I adjusted it. Of course, I got the permission as well. Then we validate the questionnaire in our setting. So when we do the validation, first we get the opinion from the expert panel. This is called the content validation, whether the content is appropriate to use in our study. After then, we do the construct validation. For the construct validation, we collect the data data from the specific population, then we run the analysis test again to calculate the Cronbach alpha, to calculate other the factor loadings, to make sure that that questionnaire is valid in our study. Then we proceed for the data collection.
Although we use the commonly questionnaire,
So, oh yes, thank you for the.
like we always usually use DES and then what it's called dreams questionnaire like that, Prof. Mila.
Oh, thank you. Yes, we use the DES, DREAM, PHQ, but for this question, they are generally, how to say that, they are validated in many study sites, many countries. So in that case, yes, we get the permission and we directly use it for our study. So I also use directly for that study. But of course, we ran the Cronbach alpha to check whether it is reliable or not. But we do not go detailed steps of the validation process.
Thank you.
Thank you very
Dr.
much.
Thank you, Dr. Mila and Dr. Neneng. So far, so hot the discussion. The next questions, maybe.
Izin bertanya, Dokter.
Okay, Yudit, ya.
Good morning, Professor Mila. I would like to ask a question, maybe some question like 3 question. Is it all right for you, Professor?
Yeah.
Yeah.
You did, yeah?
Yes.
Yes.
Okay. The first question is what Professor Mila have explained before, that there are some disadvantage for cross-sectional studies. And my first question is wait a minute.
Yes.
Yeah.
Take your time.
Why is the cross-sectional study is not suitable for disease of short duration?
Okay.
Yeah.
So, as I explained in the previous example, if the disease has a very short duration, and we may not capture all the cases. So, for example, the aim of the cross-sectional study is to investigate the prevalence. So, if I ask my students, okay, so do you have any respiratory symptoms today? Then I may miss a lot of cases because, for example, these kind of diseases like fever, respiratory symptoms, diarrhea, they are short duration diseases. And if we do the cross-sectional study, sometimes we may miss it. Or otherwise very serious diseases like a food poisoning and the condition was and passed away. Then if we do the cross-sectional study, they already died, they may not include in the data collection. So that's why short duration or very serious disease with the duration is very short, then we may miss a lot of information, a lot of data. That's why cross-sectional study might not be useful for the disease with the shorter duration.
Okay, thank you for the explanation, Professor Mila. The second question is, what is the fundamental difference between analytic and descriptive cross-sectional?
Okay, thank you very much for the question again. So yes, analytical study design and observational study design, the main difference is there is no comparison group in the descriptive study design. So in the descriptive study design, we collect the data, we calculate the prevalence of the outcome or prevalence of the other factor. But in the analytical study design, yes, we can still estimate the prevalence, we can still calculate the prevalence, and we also try to compare the two groups, disease, non-disease group, or otherwise exposure, non-exposure group. We compare and we try to identify if there is any association between that exposure factor and the disease.
Okay, thank you for the explanation, Professor Mila. The last question is, I'm sorry.
Yes.
Go on, Yudit, ya.
Mohon maaf, Dokter. Tadi ada yang lewat jadi
One more
agak.
question. Okay, sure.
Okay. Okay. Why is not efficient for rare disease, like you have explained before for the answer for the first question? Like the symptom might not appear when we doing the study, and why is it not efficient for the rare disease, Professor?
Yeah, thank you very much for the explanation. So for example, like I would like to know the prevalence of the very rare disease. Then if I collect the data 1000, I may not capture one. If it is the rare disease, then we may need a larger sample size. Another one is if we would like to do the analytical cross-sectional study design for a rare disease, for example, very rare genetic disease, that is the outcome disease. I would like to find out whether it is associated with the others or not. After the data collection, I may end up with the 0 disease group, and then the others are in the non-disease group, so we cannot proceed for it. So if the outcome disease is very rare, cross-sectional study might not be suitable because we generally collect the sample from the whole population. There may be people with disease, there may be people without disease. If the disease is rare, very difficult for us to proceed. So that's why if the outcome disease is rare, and if we would like to find out other associated factors, we would recommend to conduct the case control study. So in the case control study, okay, that genetic disease is very rare, 1 out of 10,000, 1 out of 20,000. Yes, we know, but we can contact to the disease registrar, or we can contact to the hospital. We can identify, okay, these people are having that rare disease. So we can get the information from them and we can contact them. So let's say our sample size for the rare disease is 50. Then from that, we can intentionally recruit that 50 as our cases, then 50 control. So case control study, that's why case control study is more suitable for the rare diseases. Meanwhile, cross-sectional study may not be efficient to investigate for the rare disease. Did I answer the question? Yeah, thank you.
Yes, Professor, thank you for the explanation.
Okay, thank you very much for the question.
Yeah, maybe for the analogy, when we want to hit something, we must hit with the right gun, something like that.
Yes, very good example. Correct. We need to shoot. We
Yeah.
need to shoot with the correct weapon.
Don't hit mosquito with the M14. Like that.
Yes. Correct.
Okay, Dr. Mila, I want to know when we have medical records in the hospital.
Yes.
And we have respondent patient, and then we open up the maybe the history of the disease from the patient last time. It is still we can call it a cross-sectional study.
Yes, we can still consider content as a cross-sectional study. Yes, but the study, the data may not be the primary data. We call it as a secondary data, but we still, content as a cross-sectional study.
Okay. Even though the data is the last past history of the disease, it's still cross-sectional.
So actually, it may depends on your research question. For example, if you would like to know the prevalence of the exposure factor, the outcome disease, then it may conduct as a cross-sectional study. But if you prefer to compare the disease group and non-disease group, so disease group patient data, non-disease group patient data, study design may change to the case control study. Or otherwise, if you would like to start from the exposure and outcome, it may be considered as a retrospective cohort.
Okay.
Yes,
Okay, thank you very much. So the soul of the research is the research questions, right?
Yeah, this research question and appropriate study design. Yes.
Maybe there is more questions for Dr. Mila. We have still 15 minutes left. Lunch time there, Dr. Mila.
I have some.
Okay, Dr. Yusuf.
questions. Dokter nanti saya dibantu kalau bahasanya kurang ya. I have in the near from our campus we have hospital, national hospital in orthopedic. We some little observation we found that osteosarcoma more commonly in the region near the pantura, apits gitu ya. Well, your suggestion, can I make cross-sectional study? We will compare benign disease, benign cancer, benign tumor with osteosarcoma from, for example, North region, Central region, and South region. The prevalence osteosarcoma compare with benign tumor in bone and soft tissue. For your suggestion to design this research. Mungkin Vindi bisa membahasakan lebih baik.
Thank you very much for the question, Dr. Yusuf. So my understanding is the researchers would like to compare the osteosarcoma with the other soft tissue or bone diseases and
soft tissue benign disease.
Benign diseases, and then would you like to identify the associated factors with that?
Ini apa? The region near from beach, beach, pantai.
Yeah, the region, because maybe the epidemiological study, there is a high prevalence in the area near by side the beach.
Yes. So for the
Pantai
epidemiological
Utara Jawa, Bu Indri.
Pantai Utara Jawa.
Pantai
The
Utara
north area in province Java.
Most commonly found from this area in then another area. It is kind of very rare disease osteosarcoma. Can be compared in north area osteosarcoma per another benign soft tissue, bone and soft tissue tumor, then be compared in another area. In cross-sectional design.
The comparing is about the region.
Comparing it about the region.
Something like that.
Yes, we can still, yes, I assume that we can still use the cross-sectional study to collect the data and then to compare the occurrence or prevalence in different regions. Yeah.
Is that right? Compare osteosarcoma with benign disease from this area, north area with another area. The prevalence penyebut apa Bu? Penyebut osteosarcoma, pembilang osteosarcoma penyebutnya benign tumor.
Apa ya pembilang itu?
Okay, so probably we can consider like that. We can consider first for the osteosarcoma from that region and the other region, which area has got more the higher prevalence. And otherwise, if you would like to compare the osteosarcoma and other soft tissue diseases in that particular region, that is also possible, which one is having the higher prevalence. So prevalence studies, yes, we usually conduct the cross-sectional study.
We study from a medical record from this hospital.
Medical record. Actually, medical records are very useful sometimes. I also collected the medical records and do the analysis for that. Some other diseases. Yeah.
Thank you, Prof.
Thank you, Doctor. Thank you. Thank you, Prof.
Okay, thank you, Dr. Mila. Maybe there is more questions for Dr. Mila. So, Dr. Mila, in the cross-sectional, if we collect the data from face-to-face, like you said, primary data, it is the same advantage or the same validation for the secondary data. The primary data and the secondary data is the same weight or something like or different, same or different.
So for the primary data and secondary data, the accuracy may be the same, but the thing is, primary data is more specific to the research question because our intention is, this is for our study. I need to specifically collect this data so we can get the accurate information, more relevant information. But for the secondary data, their aim is to record as a hospital record. Sometimes I would like to know the information about, for example, like the blood glucose level. Some of the patients' data might be missing. So that is one of the limitation of using the secondary data. Their intention is to keep as a patient record, but our intention is to we would like to get the data for our research purposes for that particular topic. So apart from that, yes, we can still use the either both primary or secondary data. because we have tried a study about the relation between the blood glucose level, diabetes, and then occurrence of the cataract by using the secondary data analysis. Then many of the patients do not have the data about the blood glucose level.
So we must measure ourselves. Yeah. Okay. Time is limit now. Maybe one more questions. 1, 2, 3. No. Okay, then it's already 2 hours. We have this discussion and presentation. So I want Dr. Mila to give our last closing statement for all this presentation.
Okay, so closing statement. First of all, I would like to thanks to the faculty from the UMS for organizing this lecture series. Actually, I'm very glad to participate in this lecture series, and I also learned a lot from the question from your experiences as well. So, okay, thank you very much for all. And then for the students, I'm really thanks for your kind interest, participation, and interaction throughout the discussion. So thank you very much.
Okay, thank you very much for the awesome presentation for Dr. Mila. And now we have to end this section. I hope we can do the collaboration for the next research maybe. Join research project from between Melaka Manipal Medical College and Universitas Muhammadiyah Surakarta. We are looking forward to get. Okay, ladies and gentlemen, my students and the students of Melaka Manipal Medical College, I must end this section, and I say thanks to Dr. Mila Htay for the presentation, and thank you for all for the questions, and we hope we can do the next series, lecture series. And don't forget to fill the certificate of attendance and the link of the presentation. Thank you very much, and we must end with Alhamdulillah. Alhamdulillah. Thank you very much.
To
Bye.
all. Thank you. Bye.
Thank you.
Thank
Oh,
you.
maybe we
Yes,
can get a photograph.
Oh yes, bro.
Pak Agus atau salah satu masuk boleh memfotokan. Saya trouble ini untuk motoin trouble sedikit. Pak Yusuf bisa fotoin Pak Yusuf.
Yeah, yes.
Probably I will use the snapping tool to screenshot.
Okay. 1, 2, 3.
Okay, so 1, 2, 3.
Okay. Thank you, Dr. Mila.
Thank you very much.
Thank you. We hope we can meet again in the better presentation and better opportunities.
Yes, I'm also looking forward to see you
Mungkin kita
again for the
bisa
presentation for the
jalan-jalan ke
research.
Malaysia, Bu Nining.
Yes, welcome to Malaysia after this. Yeah, after COVID-19 pandemic, please come and visit to Malacca. Yes,
Yeah. The last year we go to UOC.
Oh, UOC, yes.
Yes. the agenda for this year's is cancelled by
Oh yeah, definitely.
Corona, yes.
Corona.
Yes.
Yes.
Maybe
So
next time.
Yes, after this pandemic, please come and visit to our campus in Malacca. Thank you very much.
Thank you very much.
Thank you.